Sicily is expecting a tremendous surge of patients, knowing that the Sicilian government and a hospital called ISMET, which is the hospital that the University of Pittsburgh is associated with, the transplant hospital, reached out to us and asked if we could send a team there to help them with disaster preparedness. And we decided for the time being to communicate with the Italians virtually, with Zoom, with Skype, and to do it remotely, to continue our efforts. And albeit it's more difficult when you're not physically present, but we have continued to meet with them almost on a daily basis, reviewing sort of the pros and cons of disaster preparedness.
Wow, impressive. And I'm glad you've been able to connect remotely. What have you been doing when you guys do connect remotely in the meantime?
So the first thing I needed to get in particular was what is the data? In Sicily, the numbers are still relatively small. We have under 1,000 patients with coronavirus that are confirmed, but each day that number keeps increasing. So they have been certainly much more forthright and expansive with giving us materials and giving us the numbers and trying to keep us up to date with exactly what they've done in terms of disaster preparedness.
Gotcha. What would you be doing if you are able to get there? What would your team be doing when you do arrive?
But the primary focus of me going there, based on my background in disaster preparedness, is to help them organize in terms of what happens with surge capacity. You know, now they've increased their capacity by 20%, but what happens if they need to increase their capacity by 100% or 200%? Those are the protocols that we're trying to share with them, and looking at what they have now, what available resources, and how we can supplement and sort of refurbish that and reallocate, which is what crisis management is at that point.